Start doing. Confirm I'm sharing the.
Good morning, everyone. Morning, Tebe. Can you hear me?
Yes, I can. Can you hear me?
Yes, yes. Good morning, Mo. Morning, everyone that's joined us on the call. Um, Tebe and Mo, I think it's 10:03. So if you guys are good to go, we're happy to start.
All right, perfect. Thank you so much, Tove. Top of the morning to you all on this call. My name is Tebe, and I am a senior underwriter in the Medical Malpractice Division of iTOO. We are a team of 6 dynamic individuals who are looking to cement ourselves as the top medical malpractice insurer on the continent of Africa. I am not alone. My fellow speakers are Mohammed Sudiman from our MedMal team and Marlon Daniels from our claims team. So what we'll be unpacking today is medical malpractice trends in South Africa, post-COVID, the current landscape, and future projections. My job today is arguably the easiest compared to my fellow speakers. We are firstly going to answer 2 questions. 1, what is medical malpractice? And 2, why is medical malpractice important? Then we'll share some headlines in relation to medical negligence in the public sector, followed by some interesting data from the public sector. Now that we all know what we're talking about, we do not want to assume that everyone on the call knows what medical malpractice is. Therefore, I have included 2 brief definitions. According to the medical news today, medical malpractice occurs when a healthcare professional neglects to provide appropriate treatment, take appropriate action, or gives substandard treatment that causes harm, injury, or death to a person. The malpractice or negligence generally involves a medical error. This could be in diagnosis, medication dosage, health management, treatment, or aftercare. Roy Bregman of Bregman Moodley Attorney states that medical malpractice pertains to cases where healthcare professionals such as doctors or hospitals deviate from the accepted standard of care, which leads to the harm to a patient. These cases are governed by delict, enabling individuals to seek compensation for harm resulting from negligence. Both acts and omissions may be seen as malpractice. For example, provided that a medical practitioner fails to act when a reasonably competent practitioner with similar training would have, the medical practitioner can be held to account. In the same way, if treatment is rendered to a patient and the level of care meets not the standard of care of a similarly trained medical practitioner, given the same circumstances, this is also malpractice. Now, to answer the question of why medical malpractice insurance is important, I have included a video that not only explains it better than I can, but is easy to understand. But unfortunately, the video that we have right now doesn't play sound. So I think it would be best to just skip it. We do apologize for that. So what we'll do now is just share some headlines from various sources in respect of medical negligence claims in the public sector. In the interest of time, I'm only going to share brief details of two of the headlines in the slide. So the first one that you see says that more than 20,000 patients harmed in Gauteng hospitals. So this is an extract from an article from 2018 that was published in the Sowetan Live. Dr. Gwen Ramogopa, who was the then Gauteng Health MEC in 2018, expressed that more than 20,000 patients were harmed due to negligence over a period of 2 years at state hospitals in Gauteng. Dr. Gwen mentioned that the cases were in relation to allegations of negligence, incompetent staff members, human errors, secondment of patients, and system failure. And then the second headline there reads as, Health Department faces billions in malpractice claims. According to Gregory Whitaker from the Wits School of Statistics and Actuarial Science, almost 2,000 complaints were laid with the department due to medical negligence that translates to lawsuits amounting to billions of rand. In his presentation at the Actuarial Society of South Africa annual convention in 2022, titled Medical Malpractice in the South African Public Sector, Whitaker indicated that contingency liabilities were about 100 billion and were continuing to grow. These cases include a 17-year-old who was pregnant when she lost her child in the Free State after waiting 6 hours for an ambulance at a local clinic, where she claims that the staff ignored her when she sought assistance. Her baby was in a breech position and needed urgent medical attention. She claimed that the clinic staff took time to assist her, resulting in a fatality. Another case involves a newborn baby left brain damaged at a hospital in the Eastern Cape in 2018, when the hospital staff allegedly failed to monitor the mother and child during labor. The case was heard at the Mthatha High Court. However, the factual cause of the child's brain damage could not be established. So what you're looking at in terms of this graph, it shows the value of claims in billions against the Department of Health from 2018 to 2024. So between the years 2018 to 2021, what we see is an upward trend in the value of claims. From 2021 to 2024, we notice a reduction in the value of claims. So the reason for the decrease in the value of claims from 2021 to 2024 could be as a result of the temporal halt in planned procedures in public hospitals during the hard lockdown. And then this last graph that you're looking at here, it shows the total value of claim payments made in the Department of Health from 2018 to 2023. The information that we wanted to share from this graph is that claim payments made are not always equivalent to the value of the claims. We know this as the value of medical legal claims are generally inflated in the initial stage. So what I will do now is just to hand over to Mohammed, who is going to take you through the significance of medical malpractice trends and so forth.
Good morning, everyone. Trust everyone's doing well this morning. Apologies, I think there's a bit of Good morning, everyone. Sorry about that. Just a little bit of technical difficulty. My name is Mohammed Suleiman. I'm in the medical malpractice team, currently in underwriting, and we're glad to have everyone here today join us just to talk a little bit about the trends in the market, post-COVID. Today we'll be touching on the significance of these medical malpractice trends. And the impact that this has on everyone involved, whether this is patients, healthcare professionals, and the broader healthcare system. Medical malpractice is more than just a legal issue. It touches on the very core of patient safety, trust in healthcare, and the financial and professional stability of medical practitioners. By examining these trends, we better understand how they shape the experience of individuals, influence the decisions and practices of healthcare providers, and ultimately drive changes in policies and procedures within institutions. When discussing the impact of medical malpractice trends on patients, two key areas stand out, and that is patient safety and patient trust. Uh, Patient safety in South Africa is it's ensuring error-free care, which is critical. The duty of the healthcare provider is exceptionally high, and it's exceptionally higher than a lot of other professions simply because of the fact that these individuals deal with life and human beings. And by recognizing and addressing these trends, we can enhance the quality of care and safeguard patient safety. When we look at trust in healthcare, trust is the foundation of the patient-doctor relationship. Unfortunately, over the last few years, we've seen this trust diminish, and this could be due to more impersonal inactions in recent years. I think when we look at the COVID environment, this has created that sense of a lack of human interaction. Definitely, perhaps a factor in this relationship breaking down, and rebuilding this trust is essential for effective patient care and the overall health, of the system and the healthcare system. Just sort of a diagram showing the deterioration in the patient-doctor relationship and what leads to patient distrust. If we look at service delivery, this could be from individual care providers' perspective. This is lack of professionalism, poor medical competency, and defensive medical behavior. From an institutional perspective, this could be hospitals that or facilities that are more centered around maybe profits, not so much patient centered. If we look at the services itself, this trust could be caused as a result of over servicing. It could be expensive medical bills. It could be long waiting periods. Um, then we look at from a system environment perspective or from an interpersonal interaction perspective. Um, this could be lack of sharing of information, neglecting the needs of a patient, poor service attitudes, violation of privacy of patients. And from a system environment, this is then lack of government investment, inadequate health resources. With regards to medical insurance, this could be high financial, creates a high financial burden, inequity in the market, unable to protect patients' rights and so on. And this has generally broken down the trust of patients seeking healthcare. When we look at this slide, the slide focuses on the critical importance of accuracy in healthcare and the foundational role of trust between patients and providers. When we look at the accuracy in healthcare, ensuring that diagnoses are accurate, surgical procedures are properly executed, and medications are administered correctly is crucial to preventing harm to patients. Mistakes in any of these areas can lead to severe consequences, including prolonged illness, additional surgeries, or even the loss of life. Trust in healthcare, trust is a cornerstone for providing effective healthcare. It influences whether patients feel comfortable seeking care, how well they adhere to treatment plans, and their willingness to communicate openly with their healthcare providers. Without trust, the patient-provider relationship breaks down, leading to potential gaps in care, non-compliance, and worse health outcomes. By looking at these general claim scenarios, it demonstrates the type of harm patients can face, such as misdiagnosis, surgical errors, and underscore the need for both accurate medical practice and strong patient trust. What we need to emphasize, I would say, if we look at prevention, the goal of focusing on these areas, is prevention. accurate diagnosis, proper procedures, and correct medication are not just about avoiding liability. They're about safeguarding patient lives and health. From a trust isn't just beneficial for patient satisfaction. It's a protective factor. When patients trust their providers, they are more likely to follow through with treatments and provide critical information that can prevent errors. The ripple effect of medical errors, how they affect not just the patient, but also their families, healthcare providers, and the institution's reputation. This highlights the broader significance of ensuring accuracy in care. So we look at the significance of the financial and emotional consequences that medical malpractice can have on patients and their families. Malpractice can lead to costly additional treatments, legal fees, loss of income, especially if the patient requires extended time off work or is unable to return to their job. For example, a 2022 study showed that medical malpractice claims in South Africa often result in settlements that can devastate the family's finances, with some cases reaching into millions of rands. Emotional stress, the psychological impact on both patients and their families is profound. This can include anxiety, this can include depression, and a sense of hopelessness. Studies indicate that patients who suffer from medical errors are at a higher risk of developing PTSD due to the trauma associated with their experiences. And then obviously long-term trauma. Patients often feel a deep sense of betrayal as the trust they've placed in the healthcare professional is broken. This can lead to long-term trauma, affecting their willingness to seek help in the future. It's noted that patients who experience malpractice are more likely to avoid future healthcare, even when they urgently need it. Understanding these consequences is crucial for healthcare providers to take steps to prevent the occurrence of malpractice, thereby protecting both patients and their families from these devastating outcomes. We looked at the impact that these trends had on individuals or patients. We'll touch a little bit on the impact it has on healthcare providers. A significant percentage of healthcare providers face malpractice claims at some point in their careers. A study done by the New England Journal of Medicine showed that 78%, this may not be South African data, but it shows that it is a common occurrence in the world where 78% of surgeons and 46% of internal medicine physicians face the medical practice claim by the age of 65. That's scary. Financial consequences, the cost of legal defense costs. Even if a claim is unfounded, the cost of legal defense can be substantial. Settlements and judgments. The average indemnity payment for settled cases can vary widely, but high-profile cases often result in multi-million rand settlements. Insurance premiums, the effect it has on insurance premiums. Increased claims can lead to higher malpractice insurance premiums, sometimes causing significant financial strain on the health providers and institution. And I think this is the domino effect that this has on the industry. In the institutional impact that healthcare providers can have, hospitals and healthcare institutions may face reputational damage and financial liabilities. They may also need to implement costly policy changes to mitigate risks. And then I think we just need to sort of highlight the importance of risk management strategies and, consulting correct legal counsel to minimize the impact of these malpractice claims. We go on further, we look at professional reputation and career implications. From a reputational damage perspective, a claim, even if dismissed, can harm a healthcare professional's reputation, and this can affect their relationship with patients, peers, and their standing in the medical community. Career impacts, credentialing, licensing, malpractice may lead to investigations by medical boards, potentially resulting in disciplinary actions, including suspension or revocation of medical licenses. Maybe a lack of employment opportunities, future employment prospects can be limited as institutions often scrutinize past claims when hiring these individuals. Professional isolation can talk to the fact that healthcare providers involved in medical practice suites may experience professional isolation, impacting their ability to collaborate and work effectively with colleagues. And definitely the emotional and mental health consequences. The stress of litigation can lead to burnout, depression, and in some cases, we've seen people take their lives as a result. We go on further, we look at the impact that these trends have on the healthcare system. Rising malpractice insurance premiums. Malpractice premiums, medical malpractice premiums have been increasing over the years. I think this is more if you look at it from a global perspective, but I guess from a South African point of view, this has had an impact for sure. For instance, if you look at the average premiums for obstetricians, these can range from R1 million to over R2 million annually, obviously depending on the work activities and the experience. It leads to defensive medicine, which we've seen. I think to avoid litigation, healthcare providers practice defensive medicine, leading to unnecessary tests and procedures. The impact is, it's estimated that defensive medicine contributes to about 5% to 10% of total healthcare costs, equating to billions and billions of rands annually, as we've seen, as my colleague has shown you with regards to that, the claims that we've seen over the past few years. And then generally overall, the cost of healthcare, the financial burden from malpractice claims and the associated defensive practices leads to higher overall healthcare costs for patients and the system. And this includes costs for legal fees, settlements, insurance, which are often passed on to patients through increased medical fees and insurance premiums. I think we need to look forward as well. There's a lot of change that is coming in the world, whether it's AI, whether it's change in the legal environment, and this can affect trends. It can obviously bring on new trends that we've not seen, and we're interested to know, what the future holds. As we look ahead, it's clear that the landscape of medical malpractice is poised for significant change. Advances in technology, particularly AI and machine learning, are beginning to reshape the way healthcare is delivered. For instance, AI-powered tools can detect diseases like cancer with remarkable accuracy. We look at, for example, IBM's Watson, which is a sort of an AI technology, and the potential impact that it's had on medicine. It's used to assist in diagnosing diseases, personalizing treatment plans, and analyzing vast amounts of medical literature. With that comes the new legal and ethical challenges. At the same time, shifts in the malpractice insurance market and evolving legal standards are likely to impact both healthcare providers and patients. In this section, we'll explore these future trends and sort of how they might influence the legal landscape in South Africa. I think the biggest thing to look at, is from a liability issue, where who's responsible if an AI system makes an error? Is it the developer? Is it the provider? the institution? I think these are the questions that do arise, when we look forward. And I guess, it's something that needs to be broken down, something that needs to be looked at in a lot greater detail. I'll be handing over to my colleague, Marlon Daniels, from claims team. He will be taking us through a summary of claim statistics and a little bit to do with trends in claims that we've seen over the past year or past few years. Over to you, Marlon.
Thank you very much for joining today's session on medical malpractice trends presented by my colleagues Mohammed and Tebe. My name is Marlon Daniels, and it's a pleasure to be here today to discuss some of the critical trends we're observing in the realm of medical malpractice insurance. In medical malpractice insurance, in medical malpractice claims, a common conundrum rises when determining whether a healthcare provider adhered to the standard of care expected in a given situation, especially amidst complex medical conditions or treatment scenarios. What we've seen is as the landscape of healthcare continues to evolve, so do the challenges and risks that medical malpractice face. And in our session today, I'll be addressing several key areas that have seen a rise in claims. I'll also be providing some insights into each and what it means for us as insurers and our clients in the medical field. Our first topic is billing disputes. As you can see there, the number is, we've seen an increase in that. And billing disputes have become increasingly common in medical malpractice claims. And these disputes often arise when patients challenge the accuracy or legitimacy of charges related to their medical care. We've also noted that miscommunication between healthcare providers and patients regarding billing, unclear billing practices, or even fraudulent billing can lead to significant legal battles. For insurers, this means an increase in the need for thorough documentation and clear communication practices to mitigate these disputes. The next topic is consent. This informed consent, so I'm just going to touch briefly on this. So informed consent is a cornerstone of medical ethics and legal practice. So when a patient undergoes a procedure or treatment without fully understanding the risks, the benefits and alternatives, it opens the door. We've noticed that it opens the door to significant legal exposure. Claims in this area typically arise when patients believe they were not adequately informed, or where consent forms are found to be incomplete or misleading. For us as insurers, this highlights the importance of ensuring that the healthcare providers have clear, consistent, and legally sound consent procedures in place. Turning to our next topic, which is always a contentious one, delay in diagnosis, referral, and treatment. We've noted from what we've seen crossing our desks is that delays in diagnosis, referral, and treatment can have severe consequences for patients, leading to worsening conditions or even preventable deaths. Such delays are often the result of missed symptoms, sometimes administrative errors, or inefficient processes within healthcare facilities. In the context of medical malpractice, these delays are a common cause of claims, as patients or their families seek compensation for the harm caused by these oversights. As insurers, we must ensure that the medical professionals are well trained in recognizing symptoms and are supported by robust referral systems to prevent such delays. Our next topic and where we've seen claims is that failure to recognize complications. The failure to recognize complications during or after a medical procedure can lead to severe patient harm and subsequent medical malpractice claims. These situations often occur when healthcare providers overlook symptoms of complications or fail to act swiftly to address them. For us as insurers, this emphasizes the need for continuous education and training for medical malpractice to improve their ability to detect and respond to complications in a timely manner. Goes back to my conundrum that I mentioned earlier. Thanks. Our next topic is improper management, performance and technique. Improper management and technique refers to situations where medical professionals fail to perform procedures correctly or manage a patient's care effectively. This can include surgical errors, the mishandling of medical equipment, or poor post-operative care. We often see that claims in this category result in significant settlements or judgments, as the harm to patients can be substantial. For us, this underscores the importance of ensuring that medical professionals are adequately trained and adhere to best practices in their field. Our next topic we've seen is that where doctors act or medical professionals act outside of the scope of practice. Practicing outside the scope of one's professional qualifications is a growing concern in medical malpractice claims. This often occurs when healthcare providers perform procedures or make decisions that they are not qualified or licensed to do. We often see this where these professionals get reported to the HPCSA and the findings are never in their favor. Such actions can lead to serious harm to patients and substantial liability for us as an insurer. Insurers, and we need to be vigilant in verifying the credentials and practice areas of those to mitigate the risk. The next topic is request for records, which is a common thing that we see on a regular basis. The request for medical records are a routine part of many malpractice claims. So these requests can become contentious when records are incomplete, inaccurate, or delayed. So we cannot emphasize enough that proper documentation is essential in defending against medical malpractice claims, as the medical records provide a factual basis for the care provided. And we as insurers must stress the importance of accurate and timely record keeping for all medical practice to avoid complications and also to raise an adequate defense for our insureds. Where we've seen also an increase in claims arising from patient monitoring. Patient monitoring problems arise when there is a failure to properly observe and respond to a patient's condition, particularly in critical care settings. This can result in undetected deterioration of a patient's condition, leading to severe outcomes and subsequent claims. We encourage our healthcare providers, now insureds, to implement and follow stringent monitoring protocols to minimize the risks of these claims. Our next contentious one is also wrong dosage diagnosis, medication, or procedure. What we've seen is that incorrect diagnosis, medication errors, and procedural mistakes are some of the most common and serious types of medical malpractice claims. These areas can lead to significant harm to patients, including permanent injury or death. For us as insurers, these claims often result in high payouts and can damage the reputation of the healthcare professional involved. It's therefore crucial for medical professionals to adhere strictly to their diagnostic protocols. They need to double check their medication orders and follow their procedures precisely, as well as the guidelines to reduce the recurrence of these errors. And moving on, I just want to give you some discuss some claim examples that we are dealing with at the moment. The first claim is in relation to a patient who had passed away following a exercise routine that he had performed at one of our insured sporting facilities. The individual was undergoing an assessment at the insured facility and suffered a cardiac arrest. Proceedings were subsequently instituted by the wife of the deceased, who alleged that whilst late husband had been undergoing the submaximum cycle assessment, he complained of discomfort and collapsed. The insured is being accused of not having the correct functioning cardiac resuscitation equipment in the vicinity where the assessment of deceased was conducted. The matter is still ongoing, and it would seem that this matter would run to trial.
This raises so much concerns in the sense that, like it's from something so taken so lightly that it's just equipment. That was a lack of equipment in the facility.
Marlon, you're on mute.
While we try to get Marlon back on to unmute himself, if you guys have any questions, please feel free to pop them into the Q&A or the chat section of.
Apologies for that, I was on mute. Our
Perfect.
next example is an individual, one of the patients who had passed away at our insured's mental health facility. This particular patient took his own life by hanging himself. The proceedings were instituted by the wife of the deceased, alleging that our insured or the staff at the facility failed to remove the shoelaces of the deceased and failed to keep him under constant supervision whilst in the care. The matter will potentially proceed to trial. Our next example is a claim involving a miner who burnt with boiling water. The claimed amount is for 1.6 million. Before the procedure actually happened, the miner burnt with boiling water. In this case, we settled the claim. The nurse was found to be liable, and the nurse was an employee of the institution, which is the hospital. The damages that were awarded in this case were 850,000 and defense costs were 175,000. As you can see from this, is that even though the claimed amount is 1.6 million, we've managed to negotiate a settlement approximately 50% of the initial claimed amount. The next claim arises from a patient who sustained severe facial burns as a result of an incorrect setting on a machine. The claimed amount here is 1,050,000. We managed to settle the matter without further action to be taken. The matter was settled out of court for 250,000 plus party costs, which then amounted to 278,000. The defense cost incurred in this was 100,000. But as you can see again, going back to this, the claimed amount, even though the claimed amounts will always be inflated, and we would have to investigate all aspects of that claim to make a determination on what a reasonable settlement would be. And I would like to hand over to Mohammed.
Thanks, Marlon. Thanks for taking us through those claims examples. That's quite interesting. nevertheless. So I think we've looked at some of the trends. We've looked at what's been happening. What we've picked up is been trending with regards to treatment of patients, what we've been seeing, whether it's billing issues, whether it's incorrect treatment of patients, misdiagnosis. And I think what we can do is we need to look at what we can control. And I think that's important. When we look from a risk mitigation point of view, there is certain things that are in our control and there's certain things that aren't in the control of professional or a healthcare facility. And I think what would be most important is adherence to professional or regulatory body guidelines. And these professionals are regulated by professional bodies like the HPCSA, like the AHPCSA and others, which then set out guidelines for professionals to carry on business, whether that's with regards to consent, whether that's with regards to treatment of a patient. These are dealt with in these guidelines, and through compliance with ethical standards, best practices in documentation and communication, and continuous professional development, upskilling oneself, is important to address these issues. Looking ahead, as we move forward, the integration of AI in healthcare promises to revolutionize diagnostics in treatment, offering new opportunities for improving patient care. However, it also brings the challenges that must be addressed, including liability issues, data privacy concerns, and the need for ethical guidelines, which is already an issue that we are seeing. The evolving legal landscape will need to adapt to these advancements to ensure that patients' safety and rights are upheld. By understanding these trends now, we better prepare for the future and work towards a healthcare system that embraces innovation while safeguarding those it serves. I think as iTOO, we are committed to embracing innovation, staying informed and adapting to these changes that we see in the healthcare landscape and going forward. Thank you so much to everyone that has joined us today. We'll just leave a few minutes open, or 10 minutes just for questions or Q&A, if there is any. We'd like to hear from you guys. Thank you so much. I can just hand over to Tove, if that's fine, or Sneh, just if there's any questions.
Thank you guys for an awesome presentation. We do have some questions on the Q&A. There's a question from Anzile who says, how long does one have to lodge a claim?
Hi guys, did you hear the question posed by Sinatemba? Mo, Malam, Tebe, you guys there? Okay, sorry everyone. Seems like we're having some connectivity issues. But if you can hear me, thank you so much for joining the session. If you have any questions that haven't been answered, please feel free to send us a message and we will get those answered promptly. Thank you very much.